Good morning.
Good
Welcome.
morning.
And I'm so excited to be at this conference and to have this video opportunity to talk to everyone about ICBT, Internet Cognitive Behavioral Therapy, and diabetes. And I'd like to say hello to everyone. My name's Felicia. I am the account executive at MindBeacon. And Kush, why don't you introduce yourself?
Yeah, I'm Kushamaya. I'm a clinical and health psychologist and one of the senior clinical directors here at MindBeacon.
Excellent. Kush, do you want to start off a little bit about why we're both here today?
Sure, absolutely. And I know you've got some questions for me all lined up as well too. But we're going to talk about how you can take care of your health with using CBT. You all know a little bit about probably mental health and the impact of mental health on taking care of ourselves. And so that's what we're here about today.
Excellent. So let's start talking about what exactly do you mean when you hear or when we talk about CBT?
CBT, of course. So CBT, or cognitive behavioral therapy, is a type of therapy used to help people manage their mental health. And it includes common mental health illnesses such as depression or anxiety, as well as how to cope with everyday stressors that are part of life for most people. Now, therapy can come in all shapes and sizes, and usually we think of therapy as involving face-to-face conversations with a professional in an office for once a week. But CBT isn't just talk therapy. It's made up of readings and education, activities, strategies, and homework, actually. So we sort of think of it as a program where one would learn skills and practice skills to face stressors and manage symptoms that come with everyday life challenges. The premise of CBT is based on this idea that our thoughts, feelings, and behaviors are all connected. And specifically, that our thoughts are what lead to our feelings and behaviors. So in CBT, people learn to understand what types of thoughts lead to negative emotions or those unhelpful behaviors that we have in our lives, so that you can eventually learn to challenge those thoughts to be more balanced, more helpful, realistic in terms of the types of thoughts that we would have. Now, of course, this is actually quite important because we can't often change the situations we are in or the hand that we've been dealt. These are not things we usually have control over. However, we do have control over what we think, which means we have more control over what we feel and what we do also.
Really interesting. So can you let us know why use CBT to manage mental health when dealing with a chronic illness, and maybe specifically talk a little bit about how it is with dealing type 1 or type 2 diabetes?
For sure. And so let's just take a step back for a moment. There's no doubt that coping with any type of chronic illness takes a toll on our mental health. The day-to-day care needs for any person with a chronic illness can often lead people to feel overwhelmed, angry, anxious, scared, depressed. And of course, we all know that our mental health and our physical health are just tightly connected. So working on our mental health can impact our physical and vice versa. So I know I'm obviously biased as a psychologist, but we do have evidence that taking care of your mental health is an important part of taking care of your diabetes, and also helps with preventing some of those long-term complications we're all concerned about. There are a lot of other reasons that someone might want to learn to have tools to kind of manage those psychological symptoms of living with type 1 or type 2 diabetes. And I just really want to encourage people to think of CBT as one of those options, right? It goes along, of course, with all the other practical tips I think most people are probably already doing, such as reaching out for social support or talking to others about their diabetes worries, or literally showing up today to this event.
Excellent. So can you give some examples of tools or strategies a person could learn when they're doing CBT to help maybe specifically with their diabetes management?
Yeah, and so I'm really glad you asked this because, as I mentioned, CBT is a type of therapy where one would learn sort of various skills to kind of deal with the challenges in their life, right? And so it can include any or even all of the following. And I'm going to share a few in just a moment. But one of them is problem solving strategies. This can be really useful. Let's say you're having trouble figuring out how to manage the logistics of living with type 1 or type 2 diabetes. This could be things such as attending a doctor's visit, managing medications, healthy meal preparation and planning. If you can understand the barriers and solutions to overcome these barriers, that can really make the difference, for example, between knowing you need to speak up more at the doctor's office to share your concerns versus actually making that happen. So problem solving strategies are a big part of CBT. Another one are relaxation strategies. Relaxation strategies are vital to managing stress. When you feel calmer, it just makes it easier to manage the demands that diabetes brings into your life. So, in CBT, you might learn various ways to bring daily experiences of relaxation, whether it's deep breathing or meditation, into your day-to-day living. Now, we all know learning to relax isn't going to make a problem go away, but it will make it a whole lot easier to deal with the problem if your stress levels aren't over the top. Behavioral activation is another one. It's an important strategy that we use in CBT to help people manage low moods or depression. It involves setting weekly activity goals and working towards meeting them. When we do behavioral activation, we see lifts in people's moods, increases our energy. It really fosters the sense of empowerment, which can, of course, make it easier to manage your diabetes care and generally just feel more control in your life. But it's often easier said than done. So in CBT, you learn ways to make this actually happen in a very systematic and a measurable way by taking small steps and looking at rewards along the way as well. Almost every part of a CBT program for chronic illness is going to include strategies to manage worry. We need to have strategies to be able to cope with feelings of anxiety, uncertainty, even things such as diabetes distress or fear of hypoglycemia. We're often told to just stop worrying, and that often backfires. Rather, we need to learn what to do if we're caught in this cycle of repetitive worry. And that's a really important part of the CBT program too. The focus of much of CBT, as I mentioned, includes recognizing and challenging unhelpful thinking. So how you think about your diabetes is going to have an important influence on how you feel and how you cope. So unhelpful thinking patterns obviously play a role in diabetes distress, but they play a role in the fear of hypoglycemia and psychological barriers to insulin. So in our CBT program, one will learn how to recognize and challenge thinking patterns that may keep you feeling stuck or just really get in the way of diabetes management. Another one is mindfulness. So mindfulness, we hear this a lot. It really is the skill of being in the present moment, rather than always being worrying about the future or kind of stuck ruminating or thinking over and over again about the past. So mindfulness can be practiced and developed through both informal and formal exercises. Directing your attention to the present often can also help reduce stress, reduce negative emotions, and just, again, make it easier to cope with your diabetes care. And then finally, I'll mention acceptance. So acceptance is an important part of managing diabetes. Often struggling to accept these kind of unwanted or painful experiences end up usually causing us more pain in the long run. So acceptance is about letting go of that struggle. Now, recognizing that diabetes is a chronic condition that you have to live with and manage is not the same as defeat or helplessness or resignation. But being in a place of acceptance means that you can make more active choices that are going to lead you towards a more valued, a more meaningful life, even in the face of diabetes. So it's not about giving up in that way.
Really, really interesting. Thanks so much, Kush. And how about people may be wondering, how long does it take to build these skills or see results from this type of therapy?
Yeah. And, because it's skill-based, it really depends on the client. Your therapist is really there to guide you through the learning, help you when you feel stuck, provide encouragement and personalization of whatever you're learning for all the steps along the way. In the therapist-guided ICBT program we offer at Mind Beacon, we provide what we call 12 active weeks of therapy. So meaning in those 12 weeks, you have the chance to communicate with your therapist. It's all asynchronous, so through messaging. You can send a message anytime you want. So you get 12 weeks of that. And after that, though, you can keep working on your own to practice and get better at your strategies. And that could be, building a good relaxation practice or challenging new unhelpful thoughts that are going to inevitably show up. Now, not everyone is going to need to learn or use every strategy that I described. You really get to focus on what you need for symptoms you're experiencing. So someone might see some really immediate results, such as relief from their anxiety and worries or improvements in their mood, but others might take some more time for it to become part of your everyday life. But the key here is that CBT is a short form type of therapy. You don't need months and years of treatment to see results.
Amazing. And so how do you know if CBT is working for you?
That's a really good,
Mhm.
point, like a very important question actually to answer because it's very in line with the CBT approach to therapy, which does involve measurement of change over time. The simplest answer is you'll know CBT is working for you if the symptoms that were interfering in your life start to reduce. This might be feeling less anxiety, maybe spending less time worrying, to being more focused in the present, having more positive moods, facing your fears more. So,
Mhm.
really, it's changes in the emotions and behaviors, and of course, the thinking that matters to you. As well, I would really hope that people would see an impact on their management of their diabetes needs. CBT for coping with a chronic illness isn't about controlling the illness per se, but the psychological impacts of having to cope with that condition. So when CBT is working, you'd also expect to see better coping and adaptation to whatever is in front of you when it comes to managing type 1 or type 2 diabetes. In more traditional CBT for a mental illness, such as depression and anxiety, success would be defined by having less of those symptoms, as well as less interference of those symptoms on your life. So that really applies in this case too. You already have plenty to manage when it comes to taking care of type 1 or type 2 diabetes. And a good CBT program is going to help you focus on that versus the mental health side effects.
Interesting, really interesting. Thanks so much. And what about if you aren't sure maybe that your psychological symptoms are actually related to diabetes?
Well,
Mm.
CBT isn't just for chronic illness
Mhm.
management. It's been around for years, and it's been shown to work for many different mental health conditions. Maybe you're having symptoms of insomnia or you have a lot of work stress. We have some really great CBT programs at Mind Beacon that would focus on learning strategies to manage those types of problems too. One of the great things about CBT is that even if you learn skills for a very specific concern or a specific time in your life, those skills don't go away and they're transferable to other areas of your life as different challenges emerge. And unfortunately, we know life is full of challenges. So, for example, if you're learning to manage worries, it doesn't really matter if you're repetitively worrying about medications and side effects or you're worrying about your job changing. The skills to cope with the worry is the same.
Interesting. I like your point about worry. And I was wondering if you can talk a little bit more about how to control if people are in a constant state of worry.
Yeah, it's gonna sound really simple when I share it, but of course, none of this is a quick fix. But it's all doable, and people of all ages and all backgrounds can really learn CBT-based skills to manage worry. Again, regardless of what the worries are about. The first thing we actually get people to do is do some tracking of their worries, kind of like a worry diary. The when, the what, the where, and this helps us identify themes and patterns in one's worry thoughts. We then teach people to challenge their beliefs about worry. People often believe that worry is a very positive trait or that it's helpful. But if you think about it, worrying about the problem is not the same as problem solving. So sometimes people are scared to worry less. They're scared to give up on worry, thinking it's going to lead to problems or it's going to lead to this like inability to cope with the what ifs. At CBT, we also get people to learn how to identify the difference between a what we call like a type 1 and a type 2 worry. So, type 1 worries are productive, they're useful, they're adaptive. This can be the first step toward active problem solving. So, a type 1 worry is about something that's quite specific, something that's in the here and now, a problem that's potentially solvable. So, when you have that worry thought in your mind, it's usually a cue that you got to focus a little bit about how to get through this problem, find out what your strategies are, etc. Type 2 worries, though, are very unproductive. They're useless. They're problematic. They don't lead to problem solving, but rather they lead to these cycles of repetitive rumination, extended periods of worrying. So, type 2 worries, I usually say, it's like about a problem that hasn't happened yet. It's like or a vague problem maybe in the future, or a bunch of problems kind of mixed together, and you can't solve that. So, knowing the difference allows you to problem solve around the type 1 and learn to challenge the type 2. So to learn to challenge the type 2 worries, we introduce people to thought records and thought challenges. And there's a whole bunch of things that go with that, but it's really learning for evidence for and evidence against and coming up with more balanced thoughts. We also teach people to use worry time. It's kind of a little bit of a trick we play on ourselves. But if you have a worry time, a specific time in your day that's focused on
Hmm.
worrying, you teach yourself to save your worries for that time versus reacting to every single worry that pops in your head and kind of chasing that thought. We know how disruptive that can be. We also learn that through that exercise, people often learn that if they postpone their worry, they don't feel the need to react to every what if that comes into their mind. And that just, makes us always feel so much better.
What you've talked about today has been so interesting. And even though I've been in the industry for quite a while, every time I talk to you, Kush, I learn something new and exciting. And I just want to thank you. So do you think that maybe you could provide any final comments for the listeners, or take home messages so that they really do understand, what cognitive behavioral therapy is and how it can help
Absolutely.
individuals with diabetes?
Yeah,
Thanks.
absolutely. Absolutely. And a few things do come to mind. So thank you for that. But um, the first thing I want to share with people is you don't need to be really unwell to start therapy. Actually, I would prefer that people start therapy before things get really tough. Maybe you have some daily anxieties that are hard to shake. Maybe you find yourself feeling more defeated some days by having to care and manage type 1 or type 2 diabetes. A CBT program for chronic illness management might just be the push you need to help prevent really a worsening of those symptoms. I always say also the risk of participating in a CBT program is pretty low. The common barriers we hear from people are usually about finding the time, and the cost for a CBT program. But at Mind Beacon, we've worked really hard on making a program that is flexible. So you can really do it at any time in your day that makes sense. It's not about making appointments and coming out of, your home every now and then. Um, a program that's customized to your needs, that's guided by a professional. It does not, as I said, have those traditional model of weekly visits to a therapist that, of course, can be quite costly. So I encourage people to think about, if they're feeling ready to reach out for some help, don't hesitate, don't wait. And I also encourage you to join Dr. Leor Newman. She's going to be on this Saturday for the Diabetes Dialogue Set 2 at 2:15. She's going to give you some additional details about our therapist-assisted internet-delivered CBT program, Mind Beacon. But if you can't wait for that, I'd encourage you to check out www.mindbeacon.com just to learn more.
Excellent. It's always great to talk to you, Kush, and I hope everybody has learned a lot about cognitive behavioral therapy. And we look forward to talking to the listeners on Saturday.
Thank you. Thank you so much. And best of luck to all of you.